A heart that is made of courage cannot fail to surmount its destiny. This study addresses the long-term efficacy of transcatheter aortic valve replacement, TAVR, using the third-generation SAPIEN 3 valve compared to surgical aortic valve replacement in intermediate-risk patients with severe aortic stenosis. Between 2011 and 2014, patients were enrolled from the PARTNER 2A trial and the PARTNER 2 SAPIEN 3 intermediate-risk registry. The study included 2,005 participants, divided into 1,069 who underwent TAVR and 936 who underwent surgery, subsequently matched by propensity score on key baseline characteristics. The intervention involved either transfemoral or transthoracic access techniques for TAVR or standard surgical methods. Primary endpoints investigated were 10-year all-cause mortality, aortic valve reintervention, and echocardiographic outcomes.
Quick take. This study compared the 10-year efficacy of TAVR using the SAPIEN 3 valve and surgical methods in intermediate-risk patients, addressing long-term outcomes like mortality and reintervention.
The study found that at the 10-year follow-up, all-cause mortality was similar between the TAVR and surgical groups, at 83.4% and 82.3%, respectively. There was no significant difference in aortic valve reintervention rates, with TAVR at 2.0% and surgery at 1.9%. Echocardiographic evaluations showed mean gradients of 11.0 millimeters of mercury for the TAVR group versus 12.6 millimeters of mercury for the surgical group. The authors conclude that TAVR with the SAPIEN 3 valve offers comparable long-term survival and hemodynamic outcomes to surgery, but presents challenges in maintaining longitudinal consistency in clinical trials.
Quick take. Over a decade, TAVR with SAPIEN 3 and surgical methods displayed similar results in survival and valve function, highlighting equal effectiveness, though tracking outcomes is challenging.
Short quiz, clinical vignette. Question: an 82-year-old female with symptomatic severe aortic stenosis is considering her treatment options. Her Society of Thoracic Surgeons score is 5.5%. What would be a valid conclusion about her 10-year outcomes from the study comparing TAVR with the SAPIEN 3 valve and surgical replacement? Option A is TAVR and surgery have similar 10-year mortality rates. Option B is TAVR results in significantly lower reintervention rates compared to surgery. Option C is surgery offers superior hemodynamic outcomes at 10 years. Option D is TAVR leads to lower 10-year mortality than surgery.
The answer is option A. The study demonstrated that TAVR and surgical methods resulted in similar 10-year mortality rates and comparable valve function, thus making option A the correct conclusion.